Over 60? Then answer me this. When was the last time you really looked at your tongue? Maybe never. You know, your tongue holds clues about your health that most people ignore for years. The color, the texture, spots, small bumps, every single detail can reveal something important that you need to know before it's too late. Now, before we dive into today's content, go ahead and hit that like button, subscribe to the channel, and drop a comment below telling me what city you're watching from. I'm genuinely curious to know where my viewers are joining me from today. And here's something I want you to do right now. Grab a mirror. Seriously, pause this video if you need to, get a mirror, and have it ready. You're going to want to check your tongue as we go through these signs together, because what I'm about to share with you could literally save your life. The tongue is one of the most underrated diagnostic tools in medicine. For centuries, doctors have examined the tongue to detect disease. In traditional Chinese medicine, tongue diagnosis has been practiced for over 2,000 years. Modern medicine has confirmed what ancient healers knew. Your tongue really does tell the story of what's happening inside your body. And after 60, these signs become even more important. Because as we age, our bodies change in subtle ways that often show up first in our mouth. The problem is, most people never look. They brush their teeth, maybe they floss, but they never really examine their tongue with intention. That changes today. I'm going to walk you through 10 strange tongue signs that could be warning you about serious health problems. Some of these are harmless. Some require immediate medical attention. And by the end of this video, you'll know exactly what to look for and when to take action. Let's get started. Sign number 10. Geographic tongue. Take a close look at your tongue right now. Do you see smooth red patches with irregular, slightly raised borders that form patterns that look almost like a map? And do these patches seem to change location over time? This is what we call geographic tongue, and it's actually more common than you might think. Now, despite its dramatic appearance, geographic tongue is usually harmless. It tends to be associated with sensitivity to certain foods, stress, allergies, asthma, psoriasis, or a minor inflammation of the mucous membranes in your mouth. Some people report a slight burning sensation when they eat something acidic or spicy, but in most cases, it doesn't cause pain. The patches can appear, disappear, and reappear in different locations over weeks or months. It's like your tongue is constantly redrawing its own map. The exact cause isn't fully understood, but we know it's not contagious and it's not a sign of infection. Think of it as a benign quirk of your tongue's surface. However, and this is important, if these patches appear suddenly, grow significantly larger, or start to burn or hurt, that's worth mentioning to your doctor. Unexpected changes after 60 deserve attention. What seems harmless today could be your body's way of telling you something else is going on. Geographic tongue by itself isn't dangerous, but sudden changes in your mouth at this age should always be investigated.
Sign number 9. Recurrent canker sores on the tongue. An occasional canker sore is normal. We've all had them. The problem is when canker sores keep coming back, especially on your tongue. This can indicate several things, and none of them should be ignored. Recurrent canker sores may point to vitamin B12 deficiency, lack of iron, lack of folic acid, weakened immunity, inflammatory bowel conditions, or autoimmune reactions. Now, there are certain foods that trigger canker sores in many people. Citrus fruits like lemons, oranges, and pineapples, nuts like almonds and walnuts, very spicy foods, and aged cheeses. If you notice a pattern between what you eat and when these sores appear, that's valuable information to share with your doctor. But here's the essential rule, and I want you to remember this. If a canker sore lasts more than 2 to 3 weeks, you need to see a doctor. Period. Persistent sores are not normal at any age, but especially not after 60. Your immune system changes as you age, your body doesn't heal as quickly, and what might have been a minor annoyance in your 30s could be a sign of something more serious now. Canker sores that don't heal can sometimes indicate nutritional deficiencies that are easy to fix with supplements. But they can also be early warning signs of systemic inflammation, autoimmune disease, or, in rare cases, oral cancer. Don't wait. Don't hope it goes away on its own. Get it checked. Sign number 8, hairy tongue. This is one of the strangest looking signs visually, but it's usually simple to fix. Hairy tongue, or lingua villosa, as we call it in medicine, occurs when the tiny papillae on your tongue grow longer than normal and accumulate food debris, bacteria, and pigments. This creates the appearance of hair growing on your tongue. The color can turn brown, black, yellowish, or even greenish, depending on what you've been eating and drinking. Now, this is more common in older adults because of several factors: dry mouth, use of dentures, decreased saliva production from medications, antibiotic use, smoking, and excessive consumption of coffee or tea. Here's the good news. It's reversible. You can improve this condition by practicing better tongue hygiene. Use a tongue scraper or your toothbrush to gently clean your tongue every day. Drink more water to keep your mouth moist. Cut back on coffee and smoking if you can, and maintain regular visits with your dentist. Most cases of hairy tongue resolve within a few weeks once you address the underlying causes. However, if the discoloration persists despite improving your oral hygiene, mention it to your doctor. Sometimes hairy tongue can be associated with fungal infections or other conditions that need medical treatment. The key takeaway here is that while hairy tongue looks alarming, it's usually a cosmetic issue with a straightforward solution. But like everything on this list, persistent changes warrant professional evaluation. Sign number 7, red, swollen tongue, or strawberry tongue. If your tongue is very red, swollen, and has prominent bumps that make it look like a strawberry, this indicates significant inflammation. In adults, especially those over 60, this can be connected to nutritional deficiencies, allergies, reactions to medications, infections, or intense inflammatory responses in your body. Strawberry tongue is a clinical sign that doctors take seriously because it can indicate several different conditions. In children, it's classically associated with scarlet fever or Kawasaki disease, but in adults, the causes are different. We see this with severe B vitamin deficiencies, particularly B12 and folate. We see it with allergic reactions to foods or medications. We see it with certain infections, and we see it with inflammatory conditions that affect the whole body. Now, if your red and swollen tongue comes with fever, extreme fatigue, or pain, do not wait. Seek medical attention immediately. Inflammation in older adults needs to be treated with caution. Your immune system doesn't regulate inflammation as effectively as it did when you were younger. What starts as oral inflammation can sometimes indicate systemic inflammation that's affecting your heart, your joints, your blood vessels. This is not a sign to ignore or hope it goes away on its own. Strawberry tongue is your body waving a red flag, quite literally. Pay attention to it.
Sign number 6. Dry, cracked, or rough tongue. Dry mouth isn't just uncomfortable, it's a sign that deserves your attention. In older adults, dry mouth can be caused by medications for blood pressure, antidepressants, treatments for anxiety, antihistamines, diabetes, dehydration, breathing through your mouth, or simply not drinking enough water. Many seniors take multiple medications, and dry mouth is one of the most common side effects that compounds over time. But here's what you need to watch for. Dry mouth combined with dry eyes can indicate Sjogren's syndrome, an autoimmune condition that's more common in people over 50, particularly women. Sjogren's syndrome occurs when your immune system attacks the glands that produce tears and saliva. This leads to persistent dryness in your mouth and eyes, and over time, it can affect other parts of your body, including your joints, your lungs, your kidneys, and your nervous system. Without sufficient saliva, your risk increases for cavities, gum disease, fungal infections in your mouth, and difficulty swallowing. Saliva isn't just water. It contains enzymes that begin digesting your food, antibodies that fight bacteria, and minerals that protect your tooth enamel.
When that protective system breaks down, your oral health deteriorates rapidly. If you recognize yourself in this description, especially if you're dealing with both dry mouth and dry eyes, talk to your doctor. There are treatments available that can help manage these symptoms and protect your teeth and gums. This is more important than it might seem. Chronic dry mouth affects your nutrition, your speech, your comfort, and your quality of life. Don't dismiss it as just part of getting older. It's a medical issue that can and should be addressed. Sign number 5, very pale or bluish tongue. The color of your tongue is a direct reflection of your blood oxygenation and overall blood health. Let's break this down into 2 categories. A pale tongue can indicate anemia, lack of iron, or a poor circulation. When you don't have enough red blood cells or hemoglobin, the tissues in your body, including your tongue, don't get the rich red color that comes from well-oxygenated blood. Anemia is extremely common in older adults, especially women, but it's often undiagnosed because the symptoms develop gradually. You might feel tired, weak, dizzy, or short of breath, but you attribute it to aging rather than a treatable medical condition. Your pale tongue is trying to tell you something. Listen to it. Now, a bluish or purplish tongue is even more concerning. This can indicate heart problems, lack of oxygen, lung diseases, or spasms of the blood vessels. When your blood isn't carrying enough oxygen, it takes on a darker, bluish hue. And that shows up first in your tongue, your lips, and your fingernails. This is called cyanosis, and it's a medical emergency if it appears suddenly. After 60, any frequent change in your tongue's color requires medical investigation. Your tongue is one of the most useful early warning systems for detecting circulation or oxygenation problems before they become life-threatening. Don't ignore this sign. If your tongue looks consistently pale or has a bluish tint, schedule an appointment with your doctor. Ask for blood work. Check your hemoglobin, your iron levels, your vitamin B12, and your oxygen saturation. These are simple tests that can reveal treatable problems before they cause serious complications.
Sign number 4, smooth, shiny, or burning tongue. If your tongue is smooth, shiny, reddish, and you feel a burning sensation, this very often means you're deficient in key nutrients. The main culprits are vitamin B12, iron, and folic acid. This condition is called atrophic glossitis. The papillae on your tongue, those tiny bumps that give your tongue its slightly rough texture, start to flatten and disappear. Your tongue becomes smooth and shiny, almost like glass. And it hurts. It burns, especially when you eat acidic or spicy foods. Now, the absorption of these nutrients decreases with age, especially in people who take multiple medications or who have atrophic gastritis, which is common in older adults. Atrophic gastritis means the lining of your stomach has thinned and produces less acid, which you need to absorb B12 and iron from your food. Associated symptoms include fatigue, weakness, tingling in your hands and feet, and memory problems. These are all signs that your nervous system isn't getting the nutrients it needs to function properly. The good news is that these deficiencies are easy to treat once they're diagnosed. Your doctor can prescribe B12 injections or high-dose oral supplements, iron supplements, and folic acid. But you have to get tested first. Don't try to self-diagnose or self-treat. Blood tests will show exactly what you're deficient in and how severe the deficiency is. Talk to your doctor about running a complete blood count, checking your B12 levels, your folate levels, and your iron studies. These deficiencies are extremely common in seniors, and they're one of the most overlooked causes of fatigue and cognitive decline. Your smooth, burning tongue is not something to live with. It's something to fix.
Sign number 3, sore that won't heal. This is one of the most important signs on this entire list. A sore, lump, or spot on your tongue that doesn't heal within 2 to 3 weeks must be evaluated immediately. It could be friction from dentures. It could be a sharp tooth. It could be inflammation or a traumatic injury. Those are the benign explanations, and they're actually quite common. But it could also be an early sign of oral cancer.
And I'm going to be very direct with you here. Oral cancer survival rates are excellent when it's caught early. But when it's caught late, after it's spread to your lymph nodes or other parts of your body, survival rates drop dramatically. Your risk increases significantly if you smoke, if you drink alcohol regularly, if you wear dentures, or if you have HPV. These are all well-established risk factors for oral cancer. Now, oral cancer doesn't always hurt at first. That's the problem. By the time it hurts, it may have already progressed. Early oral cancer can look like a white patch, a red patch, a small ulcer, or a rough spot on your tongue that just doesn't go away. Don't wait for pain. Don't wait for it to get bigger. Don't convince yourself it's nothing. If you have any sore, spot, or unusual area on your tongue that persists for more than 2 weeks, see your doctor or dentist immediately. They can perform a visual examination and, if necessary, a biopsy to rule out cancer. Early detection saves lives. This is not an exaggeration. This is a medical fact. Please, if you take away nothing else from this video, take away this. Persistent sores on your tongue are not normal. Get them checked. Sign number 2, white tongue or white patches. Not all white tongues are a problem, but some definitely are. Let's break down what different types of white discoloration mean. A thin white coating that comes off when you brush your tongue is normal. This is just a buildup of dead cells, bacteria, and food debris. It's more common if you're dehydrated or if you've been sick. A thick white coating, on the other hand, can indicate dehydration, digestive problems, or an overgrowth of bacteria in your mouth. This is your body's way of telling you that something is out of balance. White patches that scrape off easily are usually oral thrush, which is a fungal infection caused by Candida yeast. This is very common in diabetics, people who wear dentures, and older adults who've recently taken antibiotics. Antibiotics kill the good bacteria in your mouth that normally keep Candida under control, and the yeast takes over. Oral thrush is treatable with antifungal medications. It's not dangerous, but it's uncomfortable and it can interfere with eating and tasting your food. But here's where it gets serious. White patches that do not scrape off require immediate medical attention. These can be leukoplakia, which are precancerous lesions. They can be chronic inflammation. They can be persistent irritation from smoking, alcohol, or rough teeth. Leukoplakia appears as thick, white patches that are firmly attached to the tissue of your tongue or the inside of your cheeks. You can't wipe them off or scrape them off. And while most cases of leukoplakia are benign, some can progress to cancer over time. This is especially true if you smoke or drink heavily. The combination of tobacco and alcohol dramatically increases your risk of oral cancer. And leukoplakia is often the first visible sign. Here's your rule. If something white remains on your tongue for more than 2 weeks and doesn't come off with brushing, see a doctor. Get it evaluated. Get a biopsy if necessary. This is not the time to wait and see. This is the time to act. Sign number 1, enlarged tongue or tongue with teeth marks. This is one of the most ignored signs by older adults, and it's also one of the most revealing. If your tongue has indentations from your teeth along the sides, or if it seems larger than normal, this can indicate several significant health problems. The most common causes are hypothyroidism, sleep apnea, fluid retention, hormonal imbalances, chronic inflammation, or rare protein deposit diseases like amyloidosis. Let's talk about hypothyroidism first. Your thyroid gland controls your metabolism, your energy levels, your body temperature, and much more. When your thyroid is underactive, everything slows down. You gain weight, you feel cold, you're exhausted, your hair falls out, your skin gets dry, and your tongue swells. An enlarged tongue is actually one of the classic physical signs of hypothyroidism, but most people don't know to look for it. They focus on the fatigue and weight gain and never think to check their tongue. Sleep apnea is another major cause. When your airway collapses during sleep, your body compensates by pushing your tongue forward and enlarging it over time. This creates a vicious cycle. The larger your tongue gets, the more likely it is to block your airway, which worsens your sleep apnea. Sleep apnea isn't just about snoring. It increases your risk of heart attack, stroke, high blood pressure, diabetes, and cognitive decline. It's a serious medical condition that often goes undiagnosed for years. An enlarged tongue often comes with other symptoms: a deeper voice, snoring, extreme fatigue, swelling in your face, hands, or feet, and difficulty breathing at night. If you recognize these signs in yourself, this deserves serious medical investigation. Ask your doctor to check your thyroid function with blood tests. Ask about a sleep study to evaluate for sleep apnea. These are both highly treatable conditions, but only if they're diagnosed. And in rare cases, an enlarged tongue can indicate amyloidosis, a condition where abnormal proteins build up in your organs and tissues. This is uncommon, but it's serious, and early detection is critical. The bottom line is this: an enlarged tongue with teeth marks is not just a cosmetic issue. It's a symptom, and symptoms deserve answers.
Your tongue is one of the most ignored parts of your body, but it's also one of the most revealing, especially after 60. Think about what we've covered today: geographic tongue, recurrent canker sores, hairy tongue, strawberry tongue, dry, cracked tongue, pale or bluish tongue, smooth, burning tongue, sores that won't heal, white patches, an enlarged tongue with teeth marks. Each of these signs is your body's way of communicating with you. Your body is always talking. The question is, are you listening? Now, I want to be very clear about something. This video is for educational purposes. Only a doctor can diagnose and treat medical conditions. I'm giving you information so that you can be an informed advocate for your own health. But information without action is useless. So here's what I want you to do. Keep up with your regular checkups. Get your blood work done annually. Visit your dentist every 6 months. And never, ever ignore changes in your mouth. Your mouth is the gateway to your body. Inflammation in your mouth affects your heart. Infections in your mouth can spread to your bloodstream. Nutritional deficiencies show up first in your tongue before they cause damage to your nervous system. Paying attention to your tongue isn't vanity. It's preventive medicine. If this video helped you, do me a favor. Hit that like button so more people can find this information. Subscribe to the channel so you don't miss future videos on health and wellness for seniors. And share this with someone in your life who needs to hear it. Your health is your wealth. Protect it, nurture it, and pay attention to the signs your body gives you. I'll see you in the next video. Stay healthy, stay informed, and take care of that tongue.